Hello and welcome. Welcome to this presentation on neuropathy and balance problems. I'm glad you're here. And if you're here, I know you're here for a reason. The reason you'd like to learn how to improve or help neuropathy and balance problems. So during this presentation, I'm going to teach you how to do so. So healing is a matter of time, but is sometimes also a matter of opportunity. We're going to take this opportunity. By the way, that's Hippocrates, father of medicine. We're going to take this wonderful opportunity, and I'm going to teach you everything I possibly can on neuropathy and balance problems. Sorry about the glare from my glasses, that is, not my head. How do you improve neuropathy and balance problems so you can experience a greater quality of life? And there is a problem. There is a big problem. Neuropathy and balance problems will steal your quality of life and take away and challenge your independence. Now, I'm not trying to scare you. I am going to tell you the real consequences. I'm not a pessimist. Again, no scare tactics. You deserve to know what will happen as this progressively gets worse. When I say this, I mean these conditions, these complications of neuropathy and balance problems. So I'm going to give you this information in a very straightforward manner, in a manner that will actually help you on your own to manage these conditions. So that being said, thrive, better balance, improve your ability to sleep, and have less pain. When you have nerve damage or neuropathy in your legs and feet, I hesitate to say it, but you're probably going to lose the ability to drive safely prematurely. So again, I'm not being pessimistic. I don't want to worry you unnecessarily, but you need to be aware of these unfortunate consequences with these conditions so you can prevent some of these issues from happening. So I'm going to show you how and why that happens neurologically. That's not my opinion. That's what happens when you're losing nerve cells in your legs and feet. You're not going to be able to feel the same. Even if you think and know that you can drive okay now, it is a foregone conclusion to what happens as an unfortunate complicating factor with neuropathy or nerve damage in the legs and feet. So losing the ability to drive is the biggest complaint I've had in my clinic over the past 10 years. So I'm positive about this. Just hang with me, listen to the information, and I think that you'll get a whole lot out of it. Balance. Balance is always my biggest concern. It is the second most common complaint that we've had through the years. It's obviously a big concern. Falls, luck runs out with falls. Um, don't allow yourself to become a statistic related to falls, which I will give me a couple minutes and I'll read you the statistics on falls. And then again, reduce your pain or the symptoms of restless leg syndrome so you can sleep through the night. Reduce your symptoms related to the nerve damage or the neuropathy so you can sleep through the night. Get your life back. So let's teach you how to do this. There are three things that I want to accomplish for this presentation. Here are my three goals: awareness, preservation, and a plan. Let's break those down. Awareness. So I'm going to teach you the basics so you have a very good understanding of what causes balance problems in nerve damage or neuropathy and what you can do about them. So what causes your nerve damage? How do nerve cells heal? How do you get them to heal? How do you start helping them on your own? How do you start this process? How bad are you? So you have truly a self-awareness. There's a whole spectrum of these conditions of neuropathy and balance problems. Where are you on the spectrum? How severe is your nerve damage? And with a neurologic condition, you're going to learn you can't, it's not wise, it's not a good idea to relate the health of your nerves on how bad they feel. So as you well know, it's developing a balance disorder or problem is not necessarily painful, unfortunately, until a person falls. Neuropathy, nerve damage in the legs and feet, again, this is going to shock some of you, but it's not always painful. So how do you find out where you are on the spectrum of neuropathy and balance problems. So of course, I'm going to teach you that as well. Preservation. Preservation is key. You have to preserve what you have. I'm going to teach you how to do so. How do you keep nerves alive? How do you keep neurons or nerve cells alive? I'm tapping to the back of my skull, back of my head here, because that's where the cerebellum, the balance organ, is located. So whether it's a nerve cell in your big toe, the nerve cells in your legs and feet, or neurons or cells in the brain or back of the brain, how do you keep them alive? What do they need to live? What do they need to thrive? So of course, I'm going to teach you that. During this presentation, I'm going to go through probably a lot of medical research and studies and clinical trials, things I've read and compiled through the years of working with these conditions, which would probably be exciting for most of you. Anyway, my point is, most of the studies, so I'm going to go through, when I'm going through them and I'm giving you this information, I'm going to talk to you about common threads. What do most of the authors, the doctors that are part of the research or citing the research, what are they saying? And here's the point. The nerve cells have to be alive. So they talk about preservation, or this matters with a surviving nerve cell. Preservation is key. If you want to just stay how you are, you'd be happy if you didn't get any worse. Some of you watching this may think that, and that's totally fine. But you're going to have to know how to keep nerves alive just to do that. So preservation is key, and I'm going to share with you again with what some of the medical research says on that topic of preservation. And a plan. What's the plan? What are you going to do? What are you going to do tomorrow to make sure you don't fall? What are you going to do to keep your balance from getting worse? What are you going to do to keep your neuropathy from getting worse or reduce the pain? So I'm going to show you how to put together a plan. Sorry about that. Let's see if we can move this out of the way here. What can you do on your own to improve your neuropathy and your balance problem? So I'm going to teach that. So even if you'd like to stay the same, again, with what I was saying on the last slide, I meet people and they have this idea and this logical thought of, you know what, as long as my neuropathy does not get any worse, I can live with how it is. So I'm not making you wrong, but a lot of people will make a statement like that if they don't have a lot of pain. Here's the bad news. Neuropathy does not always hurt. That is confusing, and I'm going to clarify all of the confusing aspects of these conditions on this presentation. So I understand the confusion, but these conditions, neuropathy will not stay the same. Damaged nerves will not stay the same, even if your feet do not hurt any worse. So back to the original point is, I'm going to teach you how to develop a plan. So even if you want to stay the same and not get any worse, you got to have a plan to do it. If you would like to get better or manage this, make your nerves some better and be able to manage it from there, of course, I'm going to teach you how to do that as well, or at least the premise and the basics on how to develop a plan to do so. So raise your hand if you have any of these sensations or signs that I'm going to cover in your legs or feet. Numbness, burning, tingling, pins and needles, sharp shooting, electric type jolts, feels like ice pick stabbing or fleeting pain, muscle cramps or Charlie horses, usually described to be worse in the evening. Your socks feel wrinkled or bunched up under your feet, even when they're not. Feels like you have extra thick padding or soles on the bottom of your feet. And some people say it feels like I'm walking on clouds, stumps, bubble wrap. Hear lots of different descriptions on how that thickness, they just felt like their skin on the bottom of their feet, something's getting thick because you're losing sensation. How about if your ankles, your feet, your toes are becoming increasingly harder to move, they're becoming stiff, or they feel tight. Coldness is also usually described to be worse at night. Uncontrollable movements in your legs or feet, or it feels like you have to move them just to get them more comfortable, or you have restless leg syndrome, or you've been diagnosed with restless leg syndrome, which is just part of neuropathy. Hopefully during this presentation I can cover that for you. Weakness in your legs. It's hard to walk any distance at all. Trouble walking, especially on stairs, or even taking one step, or you're definitely, again, worried, less than sure-footed, going up or downstairs, or walking on uneven terrain like in your yard. Or you have a balance problem. You know that you have a full-blown balance problem. If you said yes to any of these, you're definitely in the right place for this presentation. Let me start with something. This may seem a bit heavy, but this slide right here could sum up and encompass so much of this presentation that I'm giving for you right now, and it's out of the Journal of Clinical and Diagnostic Research. I'm always looking at research related to neuropathy and balance problems. And here's just one sentence out of a study that is validating the test, making sure the test that we use for the peripheral nerves that go down your legs and your feet. This is one sentence that it's just really concerning, and I want to share it with you just so you guys have a perspective here. Neuropathy is one of the most important complications which, if not recognized and treated early, may result in significant disability and a poor quality of life. So, and if I didn't finish my sentence a second ago, they validate, in medicine, they validate testing procedures to make sure they're reliable. So again, the test we use, standard neurologic assessment for peripheral nerves, and it's quantified in this test called a TCS test. Anyway, it's a validated test, has been for many years. It's a reliable test. Here's one sentence out of this study. Neuropathy is one of the most important complications if it's not recognized and treated. Now, here's a quick takeaway. They probably wouldn't be saying treated if there were no known treatments. So, of course, I'm going to share with you known treatments, and I'm going to share with you the therapeutic protocol and the treatments that we use, or to some degree, as many of them as I can during this presentation, what we do and have seen to improve balance problems in neuropathy. So if it's not caught early and treated early, it may result in significant disability. This is what you deserve to know. Nobody tells you guys this. You need to be aware, okay? You have to stop this, keep it from getting worse, or you run the risk of becoming disabled, losing your quality of life. So let's give you a basic understanding. I meet with people every day in the clinic, and I still feel like there's a lot of confusion just around the word neuropathy. So let me break this down for you and just again provide clarification. Take the word neuropathy and cut it in half. You have neuro, which means nerve, and pathy means abnormal, disease, or damage. So hear me out. Neuropathy, peripheral neuropathy, diabetic nerve pain, nerve damage, mononeuropathy, polyneuropathy, chemo-induced neuropathy, idiopathic neuropathy, etc., etc., etc. They all mean the same thing. Neuropathy means nerve damage. Okay, that's your takeaway from this. And that's just, it is a vague term that's now commonly used to describe when you have nerve damage in the extremities, and the lower extremity, the legs and feet, are much more common. So I don't want you to be confused, period. Especially because I'll use the word neuropathy and nerve damage interchangeably. So neuropathy is nerve damage. That's all it means. You have three basic parts to your nervous system. You have autonomic, central, and peripheral. Autonomic are your nerves that come off the bottom of the brain or brain stem and the spinal cord, and the offshoots are peripheral nerves, go to your internal organs mostly, and they work automatically. You don't have to tell your heart to beat. You don't have to tell your diaphragm to pull down and your lungs to fill with air. These things happen. This is part of your autonomic nervous system. Your central nervous system. Your central nervous system is made up of four parts, four main parts for your central nervous system. Brain, cerebellum, brainstem, and spinal cord. Now, on the next slide, I'm going to show you a picture of some of those. And then your peripheral nervous system. So for our discussion, for this presentation, number 2 and number 3 are the most important. And I'm going to cover those in a lot better detail for you. So central nervous system and peripheral nervous system. Let's pick those apart real quick. So here is a slide of your central nervous system. Now, I put the cerebellum in red because for this presentation, for the purpose of balance problems in neuropathy, the bottom of the brain, basically 2 humps, a left and a right, they join together. The cerebellum is the most important organ that we're going to discuss. Even if the nerve damage in your feet are burning, the nerve damage is in your legs and your feet, it's not that I'll make it about the cerebellum, but a way for you to think about it is the signals that go to and from the legs and feet. The cerebellum is the gatekeeper. Now, the cerebellum is the balance organ. It's how you control balance and coordinated movements. The cerebellum. So you look on the slide here, you'll see the big part, which everyone probably is aware of what the brain looks like. On the inside of the brain and the stalk going down, it's kind of faint on this slide, so just bear with me, is the brain stem, and the brain stem goes into the cord. For this presentation, if you want to have better balance and a good understanding of what we're discussing, it is the guy in red here, the cerebellum. Peripheral nervous system. So there you go. Starting at the top and working down again. So you have the brain, it goes down the brain stem and then into the spinal cord, and the offshoots, if you will, are the nerves that come off of the cord that run down your arms into your hands, your legs into your feet. Those are your peripheral nerves. Now, the word peripheral, if you look on the left side of the slide here, it says peripheral nervous system. The word peripheral just means outside from center. Again, because I don't want any confusion for you guys, peripheral vision, peripheral nervous system just means outside from center. So people hear the word or the phrase peripheral neuropathy, and sometimes they're not sure if they have that or they have neuropathy. No, it means the same thing, just the nerves that go down to your legs and your feet for what we're talking about during this video, peripheral neuropathy. Okay, so your peripheral nerves. So again, we're discussing your central nervous system and your peripheral nervous system. You get your balance 3 ways. Now, this is still part of our basic understanding here. You get your balance 3 ways. This is so important. My average patient is easily in their mid-70s, easily over 65. Now, we have patients from their 40s up through their 90s. Our average patients are in their mid to late 70s. So again, this is why I think balance problems, or at least discussing them and allowing you to know how do you really get your balance, I think it's so important. 3 ways. Your eyes, your ears, not the part you see with, not the part you hear with. If you look on this slide right here, to the right of the slide when you're looking at it, where it says vestibular nerve, so that our vestibular apparatus is what gives you a third of your equilibrium. So a third of your balance comes from your vestibular apparatus. You don't have to remember that. Just know that you get your balance from your eyes, your ears, the inner ear, and the nerves in your legs and feet. The nerves in your legs and feet send up what's called proprioceptive input. So we don't have to remember that, but proprioception just means balance messages. You get your balance 3 ways: eyes, ears, nerves in your legs and feet. Why is this so important? Because anyone that has neuropathy, unfortunately, will develop a premature balance problem. Anyone that has neuropathy in the legs and feet will develop a premature balance problem. It's not your fault. The nerves that you have damage to are not sending all the information up, all the information to the cerebellum, the balance organ, and you start to become less stable for sure. Here's a timeout. Here's the bad part. Unfortunately, because of the age, the most common age demographic of the people that we serve and work with, people are led to believe or just assume it's from their age. A lot of them do. Totally not true. Physiologically, not possible. You don't have another birthday and develop a balance problem. It's a neurologic event. I know that's a tough idea for most of you watching this video, and maybe you can separate it, maybe you can't. Maybe you can separate your balance problem from your neuropathy. Maybe you can, maybe you can't. You can't, and you should be able to separate it from your age. I mean, there's a lot of things that happen as we age. You lose your hair, you get gray hair, your skin changes, we get arthritis or stenosis, bad arthritis. So there's plenty of things that happen with the aging. Losing your balance neurologically is not one of them. Okay, so not really going to try to convince you of anything, period. I'm not going to try to convince you of that. Just know that that's the truth. Physiologically, neurologically, how we're wired, you should have your balance. Most people are not told that your nerves can heal. Most people did not know that their nerves can heal. I feel bad for you guys. This has never been any different since my first neuroscience course, probably in the mid to late 90s. It's I really almost at a loss for words of what to say of how I meet with people, and not that you're expected to know anything about physiology if you didn't work or spend your vocation in healthcare. That's not what I'm implying. I'm just saying I feel like people are led to believe from other parts of their healthcare team, if you will, that your nerves can't heal. Totally erroneous. Just know that we wouldn't have stroke rehabilitation if nerves couldn't heal. There's stroke rehab at every major hospital in every major U.S. city. We wouldn't have TBI department, traumatic brain injury rehabilitation departments, again, at every major hospital in every major U.S. city. So it's a ridiculous notion to think that your nerves can't heal. Now, I'm not telling you that all of your nerves will heal. I'm just letting you know physiologically, just normal human body, your nerves have the normal ability to heal. They're not good at doing it on their own. So that's the point of this presentation. One of the points is to teach you how to help your nerves heal, how to guide them through the healing process. So moving on, just know that your nerves have the normal ability to heal. And if anybody in healthcare tells you they can't, just tell them to take out their smartphone and type in nerve healing, nerve regeneration, nerve recovery, neuroplasticity. It has several different fancy words. Just you don't even have to be fancy. Just type in nerve healing. They will get hundreds and hundreds of studies and articles and trials on how your nerves heal. Okay? Okay, so which, by the way, I'm going to prove it to you here right on this slide for you here. So I went to Johns Hopkins for this presentation just because it's obvious it's a well-known, reputable institution, and they have a search on their site, and I put in the words nerve regeneration on their site. So nerve regeneration is another phrase for nerve healing, and in 0.04 of a second, a fraction of a second, it gave me 379 studies on how nerves heal. So there's a plethora, and this is what makes me sad. People are led to believe that there's nothing can be done, and they're sitting idly by because they think that there's no help for their balance, and they're getting worse, and they're falling, and they're having fractures, or they're having sleepless nights, and they're not able. They have real angst. They feel hopeless. There's nobody's trying to help them or you with these conditions, and you feel terrible and you're medicated and you're taking gabapentin, Neurontin, Lyrica, etc., different medications that will never help the nerve cells. Now, I don't say that to minimize the use of those medications. I'm pointing out frustration with nobody's sharing this information with you guys. Okay, so your nerves have normal ability to heal. You can look it up. Anybody can look it up, and sometimes people need to. But I've done a lot of research for you, and definitely for this presentation. So here is a study I wanted to share with you because of the average patient, and I say, hey, the ability for nerves to heal has not been any different for 100 years. And people look at me dog-eared, like I may be incorrect. So I went back and I just pulled a study based in the average year our patient was born. 1943, Journal of Physiology. So on these next half dozen slides, okay, it's going to be a little dry, but this is important for you to have perspective, okay? So if you just bear with me on these next half dozen slides and just look at the highlighted portions. Okay, Journal of Physiology, 1943, it was universally accepted that your peripheral nerves will heal about 1 millimeter a day. U.S. National Library of Medicine, National Institutes of Health, or NIH. Functional recovery. So functional recovery after a peripheral nerve injury depends on surviving neurons. And then look at the bottom sentence. Look at the bottom sentence. The rate of axonal regeneration becomes slower and its extent to heal basically decreases as you age. The reason I put that on there, okay, so axonal means nerve cells. The rate of your nerve cells to heal is slower as you get older. That is the only way your age. This is important because of the average age of the patients that we work with and that are affected nationwide statistically is usually in the mid to late 70s with neuropathy and balance problems. As you age, your ability to heal slows down. It doesn't mean you can't heal. It doesn't mean your nerves can't heal. Nerves have to be alive. So even if they're damaged, it still depends on a surviving nerve cell. Neuron means nerve cell. Another one from NIH, therapeutic strategies. So there are strategies that exist that will help your nerves heal. Therapeutic strategies that enhance axonal regeneration. So therapeutic strategies, therapy that you can have done that will enhance nerve cell healing. That's what the top highlighted sentence means. Positive adaptive changes that help improve functional recovery, but also diminish undesirable consequences like burning, like pain, like numbness, tingling, sharp shooting electric type jolts. Reduce or diminish undesirable consequences. This is possible. Regeneration is dependent on their surviving nerve cells. So look at the bottom sentence I gave for you. That's my opinion, not part of it. The top part is out of the study. Preservation of your nerve cells is essential. So again, that's why I want to teach you how to keep them alive. You have to keep what you have right now. You have to keep it the rest of your life. Okay, that's one of the most important tips I'm going to give you. You have to manage this forever. You have to manage this the rest of your life. Okay, and I'm going to show you the recipe to do so. Strategies to improve functional recovery after neural injuries have to address the enhancement of axonal regeneration. However, here's the important part. This is a really important slide. The type of treatment, the intensity, the duration, which is why I'm going to share with you parts of and how to put together a plan to have a therapeutic protocol. I'm going to share with you the protocol again, or parts of the protocol that we use to improve your balance and your neuropathy. It is important to take into account the type of treatment, the intensity, the duration of the protocol, which is applied after the injury are factors that determine beneficial. This is detrimental for it to work, has to do with the basic therapeutic protocol. So I'm going to share with you the protocol that I've put together over the past decade of trial and error, working with patients that have balance problems and neuropathy, being very good at spotting patterns of what worked and what worked well and what didn't work so well. So a very, very specific therapeutic protocol. This one's from the Mayo Clinic. Peripheral nerve bridging the gap. Axons regenerate at the rate of 1 to 3 millimeters a day. Remember the first one I showed you? It said that peripheral nerves heal a millimeter a day. And that one was from 1943. So this is still what they say today. They say that peripheral nerves will heal about a millimeter to 3 millimeters a day, depending on the person and how healthy the person is, et cetera, et cetera. So just know that your nerves have the normal ability to heal. And at the bottom, look what this doctor says. Peripheral nerves can repair themselves, but they need guidance. They need guidance to do it. They need a therapeutic protocol. So Mayo Clinic, peripheral nerves can repair themselves, but they need guidance to do it. Washington University School of Medicine, St. Louis, Missouri. Here is, I'm quoting a study that I read that came out. I like this one because we're here in St. Louis and the clinic is in St. Louis, and I know that a lot of the patients I see, their doctors are affiliated with this Washington University School of Medicine, very reputable school and institution. I know we have lots of brilliant doctors throughout the nation, but especially here in the St. Louis area. Nerve injury and recovery. Nerves will regenerate at the rate of 1 inch per month. For second bullet point, for nerve regeneration, the regenerating nerve fibers need the guidance of the nerve for direction to the muscle or sensory unit. Here's the point. Your nerves will heal, top bullet point. Second one, they need guidance to do it. Your nerves need guidance to heal. At Missouri Pain Treatment Center, we have the only comprehensive therapy program for neuropathy and balance problems that help people improve their quality of life and keep your independence. We help you keep your independence by keeping the ability to drive. If you have better feeling in your legs and feet, if you're in your feet, then you'll know if you're on the gas pedal and the brake and how much pressure you're putting on them. Keep your independence. Keep your ability to drive. Do not allow yourself to become a burden. Better balance. Become more sure-footed. Reduce the risk of falling. Decrease pain. Diminish the symptoms from neuropathy so you can sleep through the night. This is true even if you've tried everything. So a lot of patients say, you know what, doc, how do I get better? How do I learn to live? They say, how do I learn to live with something that is progressively getting worse? The answer is you can't. You can't. Canes, walkers, wheelchairs, and amputations. Unfortunately, those are the consequences that happen from neuropathy. Canes, walkers, wheelchairs, and being at risk for an amputation. Unfortunately, this is true. Even if your legs and your feet still feel the same, they're not any worse. They don't hurt as bad as they used to. Or for some of you, they really don't hurt at all. Now, we need to drop a pin real quick on this slide. This is so important. This slide starts of what I'm going to talk to you about next encompasses half of the people I meet with. Half of the people I meet with, half of the people that have neuropathy will never have any pain or symptoms at all. Okay? Half of the patients with neuropathy, here's a direct quote, half of the patients with neuropathy may have never experienced any symptoms at all. So this is Dr. Vinnick, and let's see. So I've made a lot of slides, but I've also used a lot of actual compiled data here, not just from researching on the internet, but this is a journal that I get sent to my house. It's an endocrine journal. And I'll spare you some of the details, but the first couple compiled studies and trials in this journal are about neuropathy. And Dr. Vinnick Dr. Vinnick is the professor of medicine, pathology, neurobiology, and director of the research and neuroendocrine unit at the Eastern Virginia Medical School. And again, he says, and I quote, half of the patients with neuropathy may have never experienced any symptoms at all. That is so important. Why? Because half of you have symptoms from your neuropathy. You have burning, numbness, pins and needles, tingling, sharp shooting. Some of you that have those symptoms, you don't even classify them as pain. It doesn't even feel that bad. You're just aware of them. Half of the people won't even have any of those. You won't have any of those symptoms at all. So you can't wait for pain. You can, but it's not a good idea. Listen, please. It takes a working nerve cell to send a pain signal. It takes a working nerve cell to send a pain signal. And your nerve cells, if you have neuropathy or nerve damage in your legs and feet, your nerve cells are working less and less. Okay, do not wait for pain. You will have less pain as this wears on and gets worse. There's a let's call it a concept that happens. I've seen this for years now. This starts out with burning or some type of symptom in half of the cases in their feet. They hit what we call a crescendo of pain. Your pain gets worse, your burning gets worse, your tingling, your pins and needles, the off sensations gets worse, 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 and then it levels off. And for some of you, you're taking medications. Again, the most common one that we see prescribed in our clinic to the patients would be gabapentin. Now, I don't prescribe medication, disclaimer inserted. I'm not telling you to take medication. I'm not telling you not to take it. I'm not minimizing the use of it. Anyway, my point was people have less pain as their neuropathy. Damaged nerves die off. They do not stay the same. This is progressive. Let me read another common thread to you, if you will. So this is from a podiatric journal, symptomatic reversal of peripheral neuropathy. I'm going to read. Peripheral neuropathy is considered to be a progressive disease. That again is a common thread. It's unfortunate. It will not stay the same. Literally yesterday, no, today, before I'm recording this in the clinic, I learned of a patient that was told that it's only in her toes and feet. She didn't describe that it was really painful, so she was told by another healthcare person that it's nothing to worry about right now. They're basing that statement on pain. That statement is completely based on pain or how the patient feels. And I understand it. We are a symptom-driven society. So I'm not, this is not to go against the grain. You do not get more pain as neurologic conditions get worse. Some of you will. Some of you will get pain. Remember, it'll hit a crescendo and then will level off. Okay? So don't wait for pain to indicate that something is getting worse. And again, societal norm would be the more arthritis that I get or you get in your back, the more it's going to hurt. The more arthritis you get in your shoulder, the more it hurts. The more you wear out the cartilage in your knee, and it's bone on bone, the more it hurts. So I understand, but that's not going to happen with neuropathy and balance problems. So don't wait for pain. This is out of the same study that I was quoting with Dr. Vinnick, but if you think about the loss of peripheral sensation, which leads to loss of position sense and the loss of balance and coordination, this is conducive to falls and fractures. This is the scary part. Let me assure you, nobody plans on falling. Nobody plans on falling and having a fracture or breaking a bone. Okay, and luck runs out with falls. And at some point, falls are devastating. And fractures, especially with the most the common age of patient I work with, they're really hard to come back from. Don't fall. Manage your neuropathy, manage your balance problem. So as your nerves are dying off, your damaged nerves are dying off, then you're not going to be able to feel so it's the nerves and the joints. Remember the ones that send up a third of your balance. They're called proprioceptive. It's called proprioceptive input or proprioception. So those nerds. Excuse me. Those nerves are. I'm a nerd for sure. Those nerves are a conglomerate of what are called LDAs, large diameter afferents. Those nerves are in your muscles, tendons, joints, muscle spindle fibers, Golgi tendon organs, um, mechanoreceptors. Those nerves tell you where your legs and your feet are without looking, when you're not looking at them, being able to feel them. So it's not your fault, but you're losing those nerves with your neuropathic condition, with your nerve damage. You're losing them. So you're not going to know where your feet are at all times. It's not the nerves in your feet are not sending all the signals up to the balance organ, the cerebellum, and you develop a balance problem. And then you fall, and then a person has a fracture. Some of the statistics on falls are the leading cause of death from injury among 65 and older. More than half of fatal falls involve people 75 and older. 1/4 of seniors who fracture a hip from a fall will die within 6 months of the injury. So I'm not being pessimistic. And again, I would reiterate not so great news that in my clinical experience, I've unfortunately observed this where people have fallen. And you that are watching this video, I'm sure, unfortunately, you know someone that has fallen and has had a very hard time, a very tough time coming back, recovering from the fall. So not trying to scare you. I want to make you aware so we can prevent this. The most profound effect of falling is the loss of functioning associated with independent living. Go back to one of the first slides I showed you. Becoming disabled from these complications is unfortunate. So again, let's work together and let's try to avoid this. So people, this is my opinion. So I've worked with neuropathy, balance problems, 16 years of nerve problems, 11 of those. I'm in my 11th year of working with neuropathy and balance problems as I'm shooting this video for you. People that have no pain, you will get the worst. So if you're watching this and you're saying, you know, my feet really don't hurt, that is a scary proposition. Pain is the body's alarm system. If your feet are not honking on the horn saying there's a problem down here to pay attention, that's a huge red flag. People don't have pain as an indication when there's nerve damage occurring, so they're not aware of when they're getting worse or how bad it is. Often they don't learn that they have nerve damage or neuropathy until they fall. This is an unfortunate incident. I see it all the time. Let's heed the advice I'm giving you on this presentation here. Let's try to prevent this. Here's another risk of not having pain. Not only do you guys get the worst because you don't know how bad it's getting, you're at risk for amputation. So here's what happens. Literally, again, I'm giving you a real example from the day I'm shooting this recording, but this unfortunately is not as uncommon as you would think. Hence, I'm giving you a statistic out of that study I quoted earlier. 96,000 amputations in the United States every year. Had a patient opened a door. Excuse me. I just learned of someone. They opened a door. They hit their toe, their big toe, when they swung the door open. They damaged the skin, so they cut themselves basically, and they tried to doctor the wound themselves. It didn't hurt, as I'm told. Is they don't have the pain receptors. Didn't hurt, so they didn't know that it wasn't really healing. And they were doing the wound care themselves, which obviously you want to go to a medical professional that specializes in wound care. This person did not, they got an infection. It became gangrenous and they had to have their toe amputated literally last week. So that is a scary proposition as well. This is real. This is unfortunate. I'm not trying to worry you or scare you. Just know that people get blisters. I've listened to the craziest things where people did not know, no matter just a small infraction of their skin, it turned into an infection that was not controlled, and next thing you know, they're getting an amputation. So we want to try to avoid this. That's why I'm bringing it to light for you. So by the end of this presentation, you'll discover the single most crucial thing that you simply must know about your neuropathy and your balance problem. I will make sure that you do. It is simple and it's quick to find out if you're a candidate for the therapeutic process we use in our clinic. Stay with me to the end of this presentation, and I'm going to show you the keys that I use every day in our breakthrough therapy, the keys I use every day in our clinic to help people with their balance problems and neuropathy. I'm going to show you the two secrets. They're not really secret, but I I regard them. They must be secretive if I'm the only one telling people this. It's mind-boggling, folks. So anyway, stay with me. I'm going to tell you the two most important things, the two secrets to improving your neuropathy and your balance problems. I'm going to give you a gift. If you stay with me all the way to the end of this presentation, I'm going to give you a gift, and it's only for you watching this now at this time, today. How and why? So let me tell you really quickly why I started doing this and how all this came to be. When I was younger, I was 7, 8, 9 years old. As I'm told that I had a curve in my spine. So an abnormal side curve, you've probably heard of scoliosis, abnormal side curve in my spine. So my parents, they took me to the doctor, was diagnosed with this abnormal curve. They could see that I was in pain, as I'm told at times. So they really wanted to try to help me. And doctor was giving them options. And the options are you could use a brace. And the braces are like the ones I'm showing on the slide here. They go from the top of the spine to the bottom. Some go even higher or longer, if you will. Whether you're 9 years old, like I was, or you're 39 or 49 years old, wearing a brace 23 hours a day is not a pleasant idea. Now, it's necessary for some, but it's not a great idea because you get out for 1 hour each day to get cleaned up. That's it. You sleep in it and you live in it. So that wasn't a great idea. And the other option, I basically had three options. I could use a brace. We could wait and see, believe it or not. Again, that's an option that I was given. Just wait and see. So if it gets bad enough, and bad enough is defined as 45-degree curve, if it gets bad enough, then I could be a candidate for a Harrington rod surgery. So which is still a necessary surgery. Okay, bad enough again is 45 degrees. So if the spine from the front to back is supposed to be straight, and after it gets to 45 degrees, it starts to mash down on where the heart and the lungs live, and it starts to compromise those organs. So then you're a candidate for the Harrington rod surgery. They drill holes down the side of your spine and tap in these metal rods. Again, I'm not debating the necessity. I'm just very thankful that I never had to go through anything like this. As a last resort, so, and again, I'm told and read that the recovery is pretty tough, but a necessary surgery. Thankful I never had to go through it. Anyway, last resort, my parents took me to a chiropractor, so that's why I became a chiropractor. I had a very good experience with chiropractic growing up, wanted to become a chiropractor, received a bachelor's in human biology, and then as I was pursuing my doctorate in chiropractic, my mom was diagnosed with a brain tumor. And when they were exploring how bad the brain tumor was, they also found an aneurysm. So I remember listening to the doctors that were going to take out the tumor, so excise the tumor, and clip the aneurysm. They didn't. So I had all the confidence in the world in these neurosurgeons, and they truly saved my mom's life. But the scary part, what made me feel helpless, was, by the way, there's a MRI picture of a tumor, aneurysm, like a part that's going to burst, that they clipped, saved my mom's life. What made me feel so helpless was after you go through a traumatic, even though it was a necessary surgery, it's still a trauma to the brain. And my mom the preparation was, she may have to relearn. She may not be the same. So I was worried about, after she came through surgery, the rehabilitation that she may have to go through. She's going to have to relearn things that we take for granted every day. Extremely scary time, extremely scary. Um, I had studied at that time, I'm just thinking about how I want to phrase this. I had studied 3 years of neurology at the time this was occurring in my life. So I knew exactly what the doctor was talking about, but I didn't know the rehabilitation that they were talking about that my mom was probably going to have to go through. It turns out there's a whole subspecialty in neurology called functional neurology. How do you change or improve nerve function without the use of drugs or surgery? And again, not implying that drugs or surgery is not necessary. Of course, I just told you how it saved my mom's life. But there's a whole subspecialty, there's a whole study around how do you change or improve nerve function when you're not going to use drugs or surgery. Again, I would beckon back to what I said at the very beginning of the presentation, the same principles that are used for stroke rehabilitation that I'm going to share with you. So that's why I started studying how do you change or improve nerve function. There's a picture of my mom and I. She's great, recovered nicely. So I've been working with nerve problems for the past 16 years, exclusively focused on neuropathy and balance problems for the past 11 of those. And if it wasn't for my mom's experience and on the unfortunate facts that heart disease, diabetes, and neuropathy run in my family, I never would have developed the Nerve Fit therapy program. The Nerve Fit is a breakthrough therapy program for balance problems and neuropathy. So fast forward after that defining incident that propelled me into this insatiable curiosity about neuropathy and balance problems. Before I get into the lab analysis, now I'm going to read you an actual patient that we have because all of you watching this video get blood work done. You should. I'm sure all of you do. So I'm going to share with you what to look for, the basics on what to look for, what you can look for on your own blood work to what will have a direct or indirect cause or effect to your nerves, what directly affects nerve function, and what indirectly affects nerve function. So again, I'm going to share with you an actual patient and what's actually possible. But what I want to tell you is real quick is so it was about 4.5 years after my mom's brain surgery, she had a massive heart attack, okay, out of the blue, which again was extremely scary. And again, I'm listening to the doctors that just put my mom's stents in. And literally, if I think back to what the doctor was telling us, he was showing us a diagram of the heart on paper, and he was showing us where the clogs were and where he put the stents in. And so we say to the doctor, how does this happen? Because I have two uncles, my Uncle Ron and my Uncle Bill. I have two uncles that passed away from heart attacks, and I don't want my mom to die. So how does this happen so we can try to prevent it? He looks at her chart, and he thumbs through and he looks at her blood work and he goes, it's because she's diabetic. Now, at that time, she did not know that she had diabetes. This was in 2005. I'm not for a second, I'm not pointing out anybody missed anything. That's not what I believe. In fact, what I would guess from back then is that usually they assessed blood sugar differently and probably not as much on a regular basis. That's just what I'm guessing from back then. But we all know now that diabetes is unfortunately common. And according to the CDC, half of our nation, just shy of half, 45% of our nation has a blood sugar problem. Okay, and I'll quote that study in probably here in a couple minutes. So it's extremely prevalent. When when I heard that, I started studying more about laboratory analysis. And that's what I want to share with you. And I've also studied functional medicine, functional endocrinology, and a handful of other disciplines that I think are useful to people that have balance problems and neuropathy. So let me share with you an actual patient in our clinic. Now, I'm going to read from a LabCorp lab where I'm located. Doesn't matter if it's LabCorp, Quest, or any of the reputable hospitals that do your lab work. Just hear me out, because this is what we see. So I'm looking at blood work here, and even if you don't look at blood work every day, it's okay. Just bear with me. This will make sense. I'm just going to go over a couple points. What directly or indirectly affects your nerves? That's the point of this. Because your blood work doesn't lie, it tells a story. This is my favorite sentence. I mean, I'm not kidding. Your blood work will always tell you what's going on the inside of your body. I know that sounds so obvious, but I think people should lean on it more. So I'm looking at this patient's labs. This lab was, let's see, it's a fasting lab, serum glucose. Now, for those that are not diabetic that are watching this, that's okay. All right, I'm going to go over the causes, the most common, 7 most common causes of neuropathy and balance problems next. And diabetes is not number 1. I know that is shocking. So I will cover that here next. His fasting serum glucose. Now, according to the American Medical Association, AMA, and the ADA, American Diabetic Association, fasting glucose should be between 85 and 99. His serum glucose fasting was 286. Yes, 286. That is dangerous. Absolutely, that is extremely high. Hemoglobin A1C. Hemoglobin A1C is a 3-month window into your blood sugar. It's more heavily weighted on recent days, but it's still a 3-month window. It's a telltale sign. Normal is below 5.6. It's a percentage of glucose, a percentage of sugar in your blood. Now, let's just say that during this presentation, you have a glass of water. Take the glass of water, and if you filled 5.6% of that glass of water with sugar, look at the amount of gunk in the bottom of that glass. Now, again, I'm not being disrespectful or hard on anybody that has a high blood sugar problem. Just hear me out. Okay, this will make sense. Anyways, hemoglobin A1C, we know that prediabetes starts at 5.7. Hence, 5.6 is the cutoff for normal. Prediabetes starts at 5.7. Diabetes starts at 6.4. So knowing that, and then we look at his hemoglobin A1C was 10.4. 10.4. And I know, unfortunately, there are people that are watching this that have double-digit A1Cs. And again, I'm not being disrespectful or hard on you guys. I know how challenging it is to get your blood sugar under control. And if I have time, I'll shed some light on how you can have success doing that. I'm going to go to the second page of this workup. Look at the lipid panel. So that's the fat panel, or where they talk about your fats in the blood, the cholesterol, triglycerides, LDL, HDL, etc. So I have to go over this because unfortunately, most of the people I meet are on cholesterol-lowering medicine. Total cholesterol. So again, the cutoff for cholesterol at the time of this recording is 200. So his cholesterol is 227. Triglycerides. Now that's a fat and a sugar bound together. Okay. Not supposed to be higher than 150. Some studies I've read said below 100, but we're just going to go with 150 for right now. So if 150 is the cutoff on triglycerides, his is 365. 365. Now again, I would say, yes, I know that there's people that are watching this, that your triglycerides are that high, or some of you even higher, and some of you would say, oh my gosh, mine used to be double that in the past. That's not good, and that's not okay. And then I know that some of you don't know what to do about it, because I meet with people every day. So again, I'm going to try to shed light on that. LDL. Yeah, LDL, again, depending on what study you read, should probably not be over 100. His is 121. VLDL, so VLDL is very low density lipoprotein. LDL is low density lipoprotein. VLDL should not be higher than 40. His is a 73. HDL should be above, I would say above 50 based on the research I've read. Some labs will say it should be above 40. I would say you would probably want it, let's split the difference and easily, based on what I've read, above 45. C-reactive protein. So that's the lipid panel. By the way, this patient was not, let me back up. This patient was not on any cholesterol lowering medicine. I'm not condoning that. I am not saying I agree with that. I'm just letting you know the facts when I'm looking at this lab. No, so that means no Lipitor, no Crestor, no Zetia, no fenofibrate, no Trilipix, Repatha, Simvastatin, Prevestatin, Rovastatin, Lovastatin, and the other 20 I didn't mention. This patient is on none of those medications. And again, I'm not saying that I agree with that. I'm just letting you know the facts from reading with this from this patient's labs. Um, C-reactive protein, cardiac reactive protein. C-reactive protein is usually regarded as an inflammatory marker, but it's a protein that's only found in your blood if your cardiac molecules, cardiac cells are breaking down. So you really don't want this to be measurable in the blood. The cutoff is 1. If it's a 1, this patient could have uh, a risk for a future cardiovascular event. Excuse me. If it's a 3, he has a high risk for a future cardiovascular event. At the time of this lab, this patient was a 15.43. 15.43. So that's about, I'm gonna stop right there with reading the parts from the labs. But the point is, your blood work tells a story. Here's something startling. Whatever damages your nerves damages your heart. Whatever damages your heart will damage your nerves. That's why this is so important. So we go through your blood work line by line in our therapeutic protocol. We go through it line by line for what directly or indirectly affects nerve function. And everyone, and I mean everyone with a balance problem or neuropathy deserves to have this done. So, in all the numbers that we use to determine what's good or not good or what's a direct cause, it's all medically researched. Okay, so I don't have to fabricate or guess. So I met this patient because he had terrible neuropathy. This patient happened to be in the half, the statistical half that had pain or symptoms with his neuropathy. He had burning feet, etc. He had all the unfortunate classic symptoms of neuropathy. That's how I originally met him. Gave him a thorough evaluation that I'll cover here in a couple minutes on the evaluation that we use. Everyone deserves to have that done. At least you know how bad your nerves are. I'll share that with you in a minute. So anyway, I met this patient, wrote him a therapeutic protocol, accepted his case, and he followed our step-by-step guide, our step-by-step therapeutic guide on exactly what to do. And here are his labs 6 months later. So I'll read these to you real fast. I just want you to know what's possible. What's possible? Okay, his fasting serum glucose originally 6 months prior was 286. No metformin. Again, listen, very practical. Follow your doctor's advice. If you need medication, follow your doctor's advice on how to take it. That's a disclaimer inserted. I'm not telling you to take medicine or not, and I'm not saying I condone the fact that this patient was not taking medication. He was not. I'm positive of that, which is not typical. Anyway, his fasting serum glucose was 286, went down to 109. Nobody has taught you prior to meeting with this patient, nobody taught him, nobody showed him how the body uses glucose, how to help stabilize glucose. This is a reproducible, repeatable process for most. And I'm talking about type 2, insulin resistant type 2 diabetics, not type 1s, type 2, which type 2 accounts for more than 90% of all diabetics in the United States. His hemoglobin A1C went from 10.4 to 6.0. 10.4 to 6.0. And I read the lipid panel, so I'll read you the lipid panel again. 6 months later, again, we already know that he wasn't taking any medications. His cholesterol went from a 227 to 173, down to 173. So that is so important, and you're going to find out why in about 5 minutes. You're going to see how and why that is so doggone important. Triglycerides went from 365 to 167. 167. And his VLDL went down from 73 to 33. That's the very low density lipoprotein. You know how when you go to the doctor and they tell you the good cholesterol and the bad cholesterol, which is really kind of misnomer, but we're just going to go with it for this discussion. Meaning it's not totally accurate, but we're just going to leave it at that. Here's my point. The LDL is the one that clogs up the vessels. The VLDL is also the one that clogs up the vessels. His went from 73 to 33. I think that is so important. At least it was for his the health of his blood vessels. That's for sure. LDL went from 121 down to 110. So no cholesterol lowering medicine. He can do it. You can do it. This is normal patients. My patients are wonderful. They're great. They follow our advice. You don't have to eat like a bird. He didn't have to eat like a bird. You don't have to turn your world upside down to speed up fat breakdown. It's called fatty acid metabolism. So again, yes, we make cholesterol. We all make cholesterol the same way, and our bodies break down fats the same way. Again, this is a predictable, reproducible process. If somebody will just take you by the hand, look at your blood work, take you by the hand, give you a step-by-step guide on how to incrementally, not build Rome in a day. You didn't get like this overnight. So you just need somebody that will take an interest in you in figuring these things out. So last one I'll read was CRP, is cardiac reactive protein. Again, this is a predictor LabCorp put on here right under the CRP on his original one. It says relative risk for future cardiovascular event. His was 15.43. It went down to a 4.25, which he still had at the time of this second follow-up lab. He still has work to do. Okay, this is not a perfect process. It's not. He didn't have a miracle session. This patient was a compliant patient. He did what was recommended. I would say it probably wasn't that hard for him, but he definitely a successful case. So whatever damages your heart damages your nerves. Whatever damages your nerves damages your heart. 2 questions. I get 2 questions, and if you don't have these 2 questions, you will. So let me answer them right now. What do you do? That's kind of the easy part. I've already started reading some of the studies, and I'll read some more of the medical studies or the clinical trials for you, and I'll tell you more about therapy. So that's the easy part. By the way, there are multiple different therapies that we use in our therapeutic program, in the NerfFit program. Multiple different therapies. And the therapies are chosen based on the evaluation. We actually have patients that get 2 therapies, and we have patients that need 7 therapies. More is not better when it comes to nerves. More is not better. But anyway, back to the 2 questions. 2 questions are, what do you do, and is it covered by insurance? So again, I think the what do you do part is kind of easy, and I'll continue to answer that. And is it covered by insurance? I'd say no. Okay. So just for full disclosure, we possess therapies that have billing codes or CPT codes. We have therapies that do not have billing codes or CPT codes. By the way, CPT stands for Current Procedural Terminology Code. It is not up to me to get it. It is not my choice, my decision to be able to get it covered to deliver a billing code. That is not, that is, I believe the Health and Human Services Department of our government delivers the billing codes in a book, mind you, a book of CPT codes every year. So what were my opinion? This is my opinion now. So I'm always drawing a line in the sand for you for what's medical science, what's neuroscience, what's based on research, and what my opinions are. My opinion, what works the best. So in my 11th year of working with neuropathy and balance problems, the things that work the best are not covered by insurance. That is not my fault. What works the best is not covered. Okay. Yes, we possess therapies that have billable codes. It's icing on the cake. So if we, and by the way, we do not accept every case. Statistically, you have to qualify for our therapy plan. We use a very thorough test to do so, which I'll go over the test with you, or I'll go through the whole process with you. There are two basic things that I've uncovered. Let's call these the two secrets. These are the two secrets. Two things. If you can just remember these two things, if you can do these two things, you can keep your balance. You can keep it from getting worse. Some of you will be able to get better. If you can do these two things, if you can apply these two things, you will be able to get your nerves in your legs and feet better. I'm positive. Okay. Or definitely keep from getting worse. Fuel and activation. Fuel and activation. So what are fuels for nerves? Fuels for nerves. Glucose, oxygen, ATP, and nitric oxide. Glucose, oxygen, ATP, and nitric oxide. What's ATP? Adenosine triphosphate. ATP is cellular energy, in particular, nerve cell energy. So let's just call it nerve energy. ATP is nerve energy. These are the four most important for balance problems and neuropathy. Activation. Activation is the proper stimulus to excite or activate the nerve fibers or neural pathways. Activation. So fuel, activation. Fuel and activation, your nerves live. They thrive. They don't die off. You want to be able to stay how you are for the rest of your life, you've got to learn how to get fuel and activation to your nerves. Neuroplasticity. Neuroplasticity just means your nerves can heal, they can regenerate, they can recover. Fuel plus activation equals nerve healing. Fuel plus activation, nerves regenerate, nerves can recover. What are your options? So let's go over some of the options on the medical side. Again, I'm not a medical doctor. I'm going to tell you what I know at the time of this recording to be the options on the medical side. And just to be frank, they're not good. That's my opinion. But I'll let you decide. You have basically three options, as I'm aware, sitting here giving you this recording. So, most common option that I see exercised or given, prescribed for patients would be the use of anticonvulsants or anti-seizure medications like gabapentin. Gabapentin is generic Neurontin. Gabapentin, Neurontin, and Lyrica. Those are the most common. Now, there are also, I see patients that are on opioids, other strong painkillers, and antidepressants, all for neuropathy. But the most common would be gabapentin. Here's the deal. It will not do anything for the nerve cells in your legs and feet. I'm not telling you it doesn't help you in the way of reducing the pain or the burning so you can sleep, get through the night, get through the day. I'm not minimizing the use of your gabapentin, Neurontin, or Lyrica. I'm not telling you to take it. I'm not telling you not to take it. I'm merely stating the facts. Gabapentin, in a nutshell, blocks calcium channels to parts of the brain that allow you to feel the pain, the burning in your feet. It does nothing for the nerve cells in your feet. It's a seizure drug. It's for epileptics, so they don't have seizures. That was the original use and intention of that medication. Um, Same with Neurontin. Again, gabapentin is generic Neurontin. Lyrica, not minimizing the use of Lyrica. I'm not telling you to take it or not take it. I know a lot of patients tell me that their insurance doesn't cover it, so they're on gabapentin. Lyrica is just, let's call it a double whammy. Okay, I know that's not a technical term, but Lyrica just affects it blocks calcium channels in the brain and the peripheral nerves. So again, you don't feel your burning feet. And I understand there's a lot to be said for not feeling or reducing the amount of pain from neuropathy. So that's option one. Option number two would be not necessarily in this order, but as I'm recalling them for you, would a lot of patients, no, I shouldn't say a lot, but some of the patients described that they've used these compounding pharmacies. I know there's a couple in our geographic region, at least a couple, that they'll make you a sedative cream. So it's a cream that you rub on your feet and it sedates the nerves in your feet so you don't feel them. Okay. Not saying you shouldn't do that, but just it's a temporary effect. And then the other option would be shots. They could have injections or shots. Again, would be temporary. We'll do those injections. The injections that I'm speaking of are Marcaine. You go to the dentist and you're going to have dental work done, and they give you a shot of Novocaine. If you're going to have sutures or stitches, you get lidocaine. And if you don't want to feel your burning feet, they'll numb them or shoot them up with Marcaine. So I'm not saying it in a way to minimize the use of it. You just deserve to be aware that it's not going to help the nerve cells. Okay? There is no medicine that will help the nerve cells in your legs and feet or the neurons or the nerve cells in the cerebellum. So just like there's no medicine that will help just regenerate a heart cell. Okay. So that being said, those are your options. I don't think they're that good. They won't keep you from getting worse. They'll make you less aware of what's going on, which we know how important it is to minimize the pain. Let me read a couple studies to you that I think are really important. Okay. Here's a study on improved sensitivity in patients with peripheral neuropathy. The mean age was 73 years, went up to 93 years of age in this study. Those with the most severe peripheral neuropathy had a striking restoration of sensation. By the way, all of this research, I should have pointed this out earlier, they all have at the end of these studies and trials and compiled articles, the medical references that they used. This one has 20, and I highlighted, looks like I went through 1, 2, 3, 4, 5, another 5 of these out of the 20, and then you just type this information into the computer, and you can look up the studies. That's what I mean. It's not hard to do research on neuropathy or balance problems and anything related. Improvement of sensory impairment. By the way, this is from an endocrine practice journal. Improvement of sensory impairment in patients with peripheral neuropathy. Forgive me. Thanks for bearing with me. Treatment significantly improved sensory impairment associated with peripheral neuropathy. So yes, I think everyone should try these therapies if they qualify. The studies, I'm not going to sit here and read you the whole study, but the studies in here, it tells you who's a good candidate, basically. It tells you what nerves are affected from these therapies. So we use that criteria to line up patients with therapy. That's what I meant by qualifying. This therapy, as good as I'm going to tell you the therapy is, fine. Two things that you need to know. It does nothing for dead nerve cells. So nerves have to be alive even if they're damaged. And the other part is it only works really well on certain types of nerve damage. Here's another 25 studies, which again I used. It looked like 1, 2, 3, 4, 5, 6, 7 or 8 studies out of here. And let me read an aspect. Let me read a couple more sentences out of. Let's do one more. Oh, by the way, this improved foot sensitivity and pain reduction in patients with peripheral neuropathy after treatment. This is from the Journal of Diabetes and Its Complications. Don't worry, again, if you don't have diabetes, don't worry. Okay, I'm going to read you why out of this study. I remember being really excited when I read this study. One of the main reasons is there are 2,239 patients with neuropathy in this study. 2,239. That's a whole lot of people in one study, one clinical trial. It's fantastic. 98% of patients reported having significant reduction in pain. 98% of the patients in the study. Of importance, and this is important to you, of importance, especially if you don't have diabetes. Of importance, the etiology of peripheral neuropathy was not a determining factor of whether the patients responded to treatment. Let me read that again. Of importance, the etiology, which means cause, the cause of peripheral neuropathy was not a determining factor of whether the patients responded to treatment. What is a determining factor? The types of nerves involved. They go on to say there was no significant difference in the response of diabetic peripheral neuropathy and not otherwise specified neuropathy patients, meaning it didn't matter what caused it, they all responded. Hence, 98% of the patients reported having a significant reduction in pain. That is fantastic. Yes, this is a therapy that we use in our clinic for patients that qualify. Yes, I've seen it do great things through the years. I would tell anyone that qualifies for this therapy to try it. Anyone. It's not invasive. It won't hurt you. It either helps, you're either a qualified candidate and it helps, or it doesn't. And guess who knows if it helps? You do. The patient does. Almost immediately. So let's go through the 7 most common causes of neuropathy and balance problems. 7 most common causes. So I want you to play along, if you will. What is the most common cause of neuropathy nationwide? What's the most common cause of balance problems? Are you ready? Cholesterol-lowering medicine. Side effects of cholesterol-lowering medicine. This is what we've observed over the past decade. That's the #1 most common cause. And here's just one of the studies. So for this presentation, I'm not going to drag them out, but yes, I compiled 15 or more studies that talk about the detrimental effects of cholesterol-lowering medicine on your nerves. I'm not against cholesterol-lowering medicine. I've already told you heart disease runs in my family. I'm not telling you to take the medicine. I'm not telling you not to. I'm just alerting you. Now, I'm not going to sit here and pick apart all of your medications. I would never do that. It's futile. I'm just pointing out that cholesterol-lowering medicine, unfortunately, let me give you a quick discussion on it. So please pay attention to this if you're on this medicine. This will be really important to you. Okay, this concept here. For our discussion, I'm just going to explain it in the most simplest terms. Cholesterol is made by your liver. Okay, you don't get cholesterol from the food you eat. You get very little dietary cholesterol from the food you eat. Um, Cholesterol is made by our liver. Your liver makes cholesterol. You take the cholesterol medicine. Okay, that medicine blocks pathways in your liver that make cholesterol. Now, this is a layman's discussion on it. The drill down will be a little different, but here's the easiest way to explain it. You take the medicine, it blocks pathways in the liver that make cholesterol. It also blocks pathways that make ATP. Now, remember when I said fuel and activation, and you got to have fuel? Four most important fuels are glucose, oxygen, ATP, and nitric oxide. ATP, adenosine triphosphate, ATP is nerve energy. It's what your neurons, your nerve cells use for energy. Cells will not live without it. It's not your fault. It's not your doctor's fault. You take this medicine and it blocks pathways and you don't make enough ATP. Nerve cells become damaged and then they die off. That's how it causes neuropathy. That's how it causes balance problems. That's how it causes dementia. That's how it causes memory problems, erectile dysfunction. You name it. Our cells, living cells, have to have, your cells have to have ATP. Okay? So I'm not telling you to take it. I'm not telling you not to take it. And I thought I'd give you just one more tidbit to drive this point home because, again, this part is probably shocking. And it may surprise you to know that cholesterol itself isn't bad. In fact, cholesterol is just one of the many substances created and used by our body to keep us healthy. This is right off the American Heart Association website. It surprises you to know, yes, that's actually what they say on their website, and I'm sure you are surprised right now. You have to have cholesterol to be healthy. Here's what I've read. I've read in the research that your cholesterol should not be below 150. And again, yes, I know that some of you watching this, that your cholesterol is bottomed out and it's below 150, and that's part of the reason you feel like death. The nerves that we're talking about, the nerves going down your legs and your feet, the covering of those nerves, the myelin sheath, it's full of good fat. You have to have cholesterol to make testosterone, or if you're a female and you want to make estrogen, cholesterol is important for you to be healthy. It's not something bad. It gets a bad rap. It's just not something bad that you have to contend with. Okay? So hopefully you get that idea now that got to have cholesterol, and bad part is cholesterol lowering medicine causes neuropathy. It's easily the most common cause that we see neuropathy and balance problems. Easily. Diabetes is not even a close second on this cause of nerve damage and balance problems. Here are the top 7 causes. Cholesterol lowering medication, diabetes, anemia, thyroid problems, cancer therapies. AI is autoimmune conditions and food sensitivities, and stenosis. Go to number 3. Anemia means, for our discussion, let's just say anemia means that you can't get oxygen to important tissues like nerve cells or nerves. You need oxygen. So there's a dozen types of anemia. I'm not just talking about iron anemia. And there are very simple ways to figure out if you have anemia. It shows up on your blood work. I left that off of when I went over the labs earlier, but it is easy. It's easy to figure out if you have anemia, and then I believe with the proper, they're called lab markers or laboratory markers, you can figure out what type of anemia that you have. Thyroid problems, we don't really have time to go into that, but thyroid problems, thyroid sufferers in the United States are more common and more prevalent than diabetes. I was thinking about how I want to word that for you. So, yes, you heard me right. There are more people that have thyroid problems in the United States than diabetes. You just don't hear about it as much, probably because there's not as many medications to treat thyroid problems. Cancer therapies, again, not for a moment am I second guessing cancer therapies. Not for a moment. Here's something bad, unfortunate, that everybody watching realizes that unfortunately cancer has touched people's lives that you know. I mean, everyone unfortunately knows someone It's been affected by cancer. So, not second guessing the therapies, but for our discussion, let's just say that the necessary cancer therapies go in and wipe out cancer, but they also wipe out nerve cells. AI, autoimmune conditions, and food sensitivities. I lump these together on purpose because nobody wants to hear this. But let's say there are dozens and dozens of different autoimmune conditions like rheumatoid arthritis, MS, scleroderma, lupus, psoriasis. Those are all just different examples of autoimmune conditions. Um, all autoimmune conditions have a food sensitivity with them. People do not want to hear that, and I don't blame you. Um, they all have food at some point as a trigger if a person looks deep enough. And yes, I can turn a person on to the right type of lab analysis to be able to determine if their immune system is reacting to a food, a peptide, a protein, a molecule. And stenosis. Stenosis just means narrowing around the nerves in the spine. And it's most common in the lumbar spine or lower back, and especially for our discussion of the nerves that go down your legs and your feet. So stenosis. If you can imagine, remember I said my average patient is over the age of 75 or 65 for sure, our average patient. Um, Most of our patients have arthritis. Most of our patients have stenosis. These are the common 7 causes of balance problems and neuropathy. According to the Centers for Disease Control, over 45% of American adults have type 2 diabetes or prediabetes. This is scary, really scary. So if you're watching this and you don't have diabetes, or you haven't been diagnosed with diabetes, or your doctor says things like, well, watch your sugar, we're going to wait and see, you're borderline, folks, those are red flags. Those are Your body doesn't get the memo on the inside not to start blowing up nerve cells or heart cells for that matter. Your body doesn't get the memo not to start damaging until you're officially stamped with being diabetic or having diabetes. Okay, so don't be fooled by that. That's silly. Just know that you should be checked. And the way that you do that is get a marker called a hemoglobin A1C. Hemoglobin A1C. That's the real telltale sign. Bad news, Cleveland Clinic says that neuropathy is very common. 30% of Americans will be affected by neuropathy. That's 100 million people. 100 million people are going to have neuropathy. They also go on to say, again, I'm aware that there's a lot of people with blood sugar problems or diabetics. So I told you, I put on here the second sentence and our third sentence of what they say about people with diabetes. 70% of them, so 7 out of 10, get nerve damage. And they are not alone with that. Johns Hopkins also says 70%. And unfortunately, if you have nerve damage in your legs and feet, like I said an hour ago at the beginning of the presentation, you will unfortunately develop a premature balance problem. Why? Because you get your balance, your eyes, your ears, and the nerves in your legs and feet. When you have nerve damage in your legs and feet, a third of your balance and your stability, a third of that comes from the nerves in your legs and feet that are damaged. Ladies and gentlemen, you owe it to yourself. You absolutely owe it to yourself. What do you want for your own self? You don't want to allow yourself to become part of these statistics I've read to you during this presentation. You deserve to know everything that there is to know about this life-stealing, debilitating condition. Who's going to take care of you? Who's going to help you? It's sad. And I know this is uncomfortable. And you might be thinking, come on, I don't want to hear this part. Yes, I get it. And it is uncomfortable. And I'm not overdoing it. I'm just letting you know I see it every day in our clinic. I know who sits in the waiting room. I see the spouses taking care of the other spouse. Nobody plans on falling. No one plans on losing the ability to get around safely. People do not want to give up driving. This is unfortunately real. There's something you can do about it. But to do that, you have to have a plan. We already know it's going to get worse. So wouldn't you like to know if the Nerve Fit could help you? So I'm going to share, this is how you figure it out. This is what everyone with a balance problem at all, if your legs and feet feel funny at all, even if you haven't been officially diagnosed, this is exactly what you need to do. In our clinic, we charge $140 for it. This is progressive. It's not going to stay the same. Damaged nerves do not have what they need to thrive. They don't have enough fuel, or they don't have enough activation, or for some of you, they don't have enough of either. You need fuel and activation to stop or slow this down. Your nerves are dying off quickly, rapid neurodegeneration. Stop it or slow it down. We're the only ones in the St. Louis area that have this approach, this comprehensive approach called the Nerve Fit. One of our patients played professional football. He's an awesome guy. We care about all of our patients. We have lots of awesome patients, wonderful patients, nice people. And this is one of our patients that took the time, though, and wrote a 2-page testimonial. So I'm going to share just a couple sentences of what he wrote with you. So hopefully we can edit this out. Oh, nope. This is Irv Goody. He played professional football. He played for the Buffalo Bills. He won a Super Bowl with the Miami Dolphins, and he played for the St. Louis Football Cardinals. And again, I'm very appreciative that he wrote parts of his experience, and he wanted me to share them. And he says, I attended. So he was at an in-person seminar similar to what you're observing, watching, listening to right now. I attended one of Dr. Ryan's seminars, and at the time I was told that if I didn't do something about the numbness and tingling, I would not be driving a car in 3 years. Now, I did not tell him that. One of his other medical doctors told him that he wouldn't be driving a car in 3 years if he didn't do anything, which that was a big deal. So not being able to drive is a game changer. That's a game changer. That's part of losing independence. And he knew it, and that worried him. He goes on to say, I had poor balance, and my left foot was a drop foot when walking. Now, I didn't even have a chance to go over drop foot, or it's what happens as the nerves in your legs and feet, you start to lose control of them, and you get a drop foot, or you don't control it as well, and it kind of flops or slaps the ground, and you hear it walking harder than what would have been normal. So I had poor balance, and my left foot was a drop foot when walking. I fell probably 10 or 12 times. But since the treatment, I've only fallen twice, and that was last winter on the ice in my driveway. So always be careful on ice. I'm not being funny about what happened with Mr. Goody. He went on to say, that's a picture of Irv and I. I attended one of Dr. Ryan's seminars. I had tremendous success with Dr. Lewis's treatment. All of my symptoms greatly improved. I highly recommend his treatment for anyone suffering from neuropathy and its related problems. Signed, Irv Goody. You know, it's definitely impressive that he played professional football, but I would just say that, you know what, he's a normal person, just like you. Just like you watching this presentation, we're all wired the same. We all have the same moving parts. You can do this. You can do this. All you need is a plan. If you have a proper, very thorough, but proper neurologic evaluation, you can do it. So let's recap real quick. 3 most important tips I'm going to give you. This is progressive. I'm telling you this for your own sake. This is progressive. I want you to have the raw material, the proper mindset to do what's necessary so you don't become a burden, so you don't become a statistic, so you can walk, so you can drive, so you can sleep through the night. Nerves can heal. Just remember that your nerves have the normal ability to heal. You have to manage this the rest of your life. Even Irv Goody, even our patients that we help when we get better, during the time that we spend with you, we teach you how to manage it on your own so that you don't have to keep coming into our clinic. But yes, you even when you're better, you have to manage it the rest of your life. And yes, if we can get you better in the clinic, there's a high probability we can teach you how to do it on your own. By the way, I don't try to keep anyone coming into the clinic. I don't try to get rid of you. I already know that you have to manage it the rest of your life. So if I can help you get better, we will take every measure to teach you. We have a whole list of home neurologic activities that we can teach you. If you're responding to one of the high-tech therapies in the NerveFit program, I know that we can teach you in a low-tech fashion to manage it on your own. Neuroplasticity, just remember, secrets to your nerve health, secrets to keeping your balance, fuel and activation causes neuroplasticity, which is nerve regeneration. Now that you know your nerves can heal, how would your life be better? What would you like to see happen? What would you like to have happen? You know, I had a patient not too long ago said that their anniversary date is in February, and forgive me, I don't recall how many years, but it was over 50, and they've done a cruise every year, and he just wanted to be able to go on a cruise. He just wanted to, he worried about being able to walk to the airport, being able to walk on the cruise ship, be able to take the excursions. I mean, that's real. That's what people say. I just want to be able to go to my grandkids' games. I want to be able to garden. I want to be able to just step one step up on a step stool just so I can do household chores. I want to be able to sit for a while and then stand up, whether I'm at church. I don't want to bounce off the pews going down the aisle, or I'm just walking through my house. Every time I sit and I go to stand up, I have to put my hand from the chair to the table to the wall to the dresser. You guys know what I'm talking about. You get up in the middle of the night and your balance, I mean, it's a scary event because the lights may be dim and you can't see that well. You're worried about losing your balance. This is all legitimate. This is real. You just want to be able to do. What do you want? What would make it worthwhile? What transformation do you want to see happen in your life? Well, what if all this therapy did was allow you to sleep through the night? What if it made you more stable on your feet so it reduced your risk of falling? Are you able to drive safely? These are the things, again, I know I was just stating them, but these are the things that people tell me that they want to do. I want to be able to fish. I want to be able to play golf. I want to be able to do activities. I just want to walk the dogs. I want to be able to walk with my grandkids. That's what people say. Improve your quality of life. Experience a greater quality of life. You do not have to sit idly by and watch your feet die off right under your nose. It is not necessary. That's a choice. This is not your fault. None of this is your fault. Your balance problem is not your fault. Your neuropathy is not your fault. But after this presentation, after this information I've just given you, it is now your responsibility. Okay, it's up to you. I've given you the tools. You may not know exactly, but there's no way to tell you that. There are multiple different therapies. You have to get a proper evaluation. And then, yes, I can look you in the eye and tell you this is not a good idea. This probably won't help, and here's why. Or I can look you in the eye after I do your very thorough neurologic evaluation. I can tell you the reasons why this would most likely help you. It's a straightforward process. Keep your independence. your quality of life. Here's how to find out if the NervFit can help you. We do a comprehensive neurologic evaluation. History of present illness means I get to learn. I learn how long has it been going on? What do we think caused it? Do we not know what caused it? I have a chance to review your blood work. We do a Berg's balance test. We do a TCS peripheral nerve exam. By the way, the Berg's balance test, everyone needs that for a baseline. You know, if heart disease is the most common killer in the United States, and then I read a statistic to you that's true that over the age of 65 among injury, falls are the leading cause of death, then getting this calculated fall risk test is probably as good idea as getting an EKG. Okay, they're the leading cause of death among 65 over 65 from injury. I would get a calculator, I mean, if nothing else, for a baseline. So the evaluation is listed here. This is what everyone should have. It'd be hard to put together a plan or tell you what to do next without it. Everyone that watched this presentation, I'm going to give this evaluation to you. Actually, that's not entirely true. You have to call in the time allotted. If you look under this video here or to the side of the video, wherever it's posted, you have a very limited amount of time because we have limited time. I have limited space and limited time. I do not always offer this. Who knows if I actually do not know if I'll actually offer it again. I'm glad that I can do this for you now. And if you feel so inclined and you'd like to take us up on this offer, you should reach out. By whatever way I have listed on this site here, you should definitely reach out. I'm pretty sure there's going to be a number here listed for you. Call this number because I know these evaluations are limited and this is a one-time offer for you. So reach out to us if this is important to you, if you'd like to keep your ability to drive, walk, have balance, sleep through the night, reduce the pain, reduce the burning. We have limited points available. Schedule your appointment now. Wait and see is not a good idea. It's not any type of plan. Poor quality of life disability. So it is simple, it's quick, it's not painful. It's easy to find out if you're a qualified candidate for the NervFit. Good health and good sense are two of life's greatest blessings. With that, I hope you enjoyed the presentation. I know I certainly enjoyed giving it. This is what we do. I look forward to meeting you. Take care.